Good afternoon. I'm Dr. Jamie Mathias from the Austin ISD Board of Trustees, also Executive Director of MASBA, the Mexican American School Boards Association. Thank you for joining us for this conversation co-sponsored by Leadership ISD, the Mexican American School Boards Association, and the Texas Caucus of Black School Board Members. Before we get started, we want to draw your attention to features of this GoToWebinar platform. On the right-hand side, you'll see a button to be able to raise and lower your hand. Shall we go ahead and try practicing with that button? Practice raising and lowering your hand. We also see on the right-hand side a questions box for you to be able to type any questions that you have for our panelists. And finally, there's a chat box on the right-hand side for us to be able to chat as well. And without further ado, it's my great pleasure to introduce to you a trustee from the Lancaster ISD. He serves as president of the Texas Caucus of Black School Board Members. Welcome, Ty G. Jones.
Thank you very much, Jamie. Welcome, everyone. We are here, and I want to thank you guys for joining us today. The topic is disparities of pandemic proportions. And today we have before us some fine panelists who decided to join us and share their insight. We have Sherry Breed, Chief of Equity and Excellence of Fort Worth ISD. Thank you for joining us. We have Dr. Stephanie Howley, Chief Executive Officer of Austin ISD. Thank you as well. We have Regina Jacobs, Chief Equity Officer for the National School Board Association. Thank you for joining us. And we have Zach Thompson, Retired Director, Dallas County Health and Human Services.
Thank you.
Definitely want to thank all the educators who are on the call, all those who are advocates for public education. And I also want to extend a huge thank you for those family members of yours who are on the front line helping us to get through these times. What I'm going to do today is first start off with just a definition of equity so we can kind of get this thing going. And what I'm going to use is a definition that I pulled off from the NSBA's website, somewhat simplistic, but if you guys want to add any more to this, please do. And it reads, equity is achieved when all students receive the resources they need so they graduate prepared for success after high school. Okay, any thoughts on that definition? Do we need to modify it a little bit more, make it a little bit more robust, or is that enough for us? All right, I'm gonna go. Is that good? Okay. All right, so our first question, yes.
Let me just say one thing about what you just read. There's a much deeper definition of equity on the NSBA website, and I just want to point out that in December of 2017, the board embarked upon a journey to actually go deeper in defining that definition. And in doing so, I'll just say that it was really more focused around every child can, will, and shall learn, and identified that there are disparities in race and gender and students with different abilities, and actually called out that we need to identify those disparities and eradicate them. So I just wanted to put a little bit more teeth in what equity really means in this country.
All right, thank you very much for that.
Sure.
All right, so what we'll do, yes.
We do have, thank you. I haven't found a little bar to raise my hand, but I did want to share, just to extend a little bit of thank you, Ms. Jacobs, for that. I was trying to find the bar. I wanted to also say, when we started the conversation about race and equity in Fort Worth ISD, we were very clear that equal does not mean equitable. And we started with that definition because so often we use those terms interchangeably. We thought, no, equals giving everyone the same, and equitable means what is it specifically that our students need to help them be successful. Just wanted to add that little bit.
Yeah, and Ty, I did want to add, we use the National Equity Project's definition here at AISD, and that also, that definition from the National Equity Project talks about building on the strengths and talents of children. So I think when we talk about equity, we got to make sure we're not speaking from a deficit mindset, that the students are needy, but the students have strengths, the communities have strengths. And I'd like to add that equity is about policies and practices and structural change, not just about distributing resources in equitable fashion, but literally changing policies and practices that create the disparities. And like Ms. Jacobs said, we've got to talk about eliminating the disparities as a part of equity as well.
Right. Thank you all very much for those clarifications and adding to the definition. I think one thing that we may need to do at some point is actually come with a collective definition that we all can kind of agree on and begin to work in that direction to ensure that each district and all of our students are actually achieving that described goal. With that being said, I'm going to start out with our first question. And I'm going to start that off with Zach Thompson, since he hadn't had anything to say just yet. So in your view, what are the greatest impacts that this pandemic is having on communities of color, students of color, and socioeconomically disadvantaged students?
Well, I think one of the challenges that we're seeing, and let me commend the ISD, the teachers, administrators, everyone for what you have been doing and doing through this pandemic. I volunteer over in South Dallas at a food pantry. That's the one day I work a week. And in doing that process, I'm seeing, for example, DISD that brings lunches to the community and ensuring that the kids have lunches and food to eat. But what we're finding is that if you look at the population, you look at African Americans and Hispanics, we're impacted greatly during this pandemic because of the issues with healthcare. One of the issues that we facing is that when you look at health disparities, you look at heart disease, cancer, you look at stroke, and of course diabetes. This is one of the high risks for COVID-19. And what we're seeing is that in terms of the epi data that is published by all of our health departments throughout Texas, you are seeing that African American and Hispanics are dying at alarming rates, right along with whites, of course. And that's one of the issues that we have to face in terms of dealing with this pandemic. The concern is that as you drive through, and I know through the communities I drive through, I don't think they're taking the pandemic seriously because I see a number of people who don't have masks. I see a number of people who are not distancing themselves. And so I don't want to come from a deficit model, but I want to come from a realistic model. And that the realistic model is that we have to have people who are African American, who are Hispanic, and anyone else that wants to join in actually doing community education in these neighborhoods. The example I give is the school districts. And again, I commend y'all because some school districts, the teachers are washing their clothes, the students' clothes, they're doing all of these things for them. And basically the schools have taken on what social programs used to do. And so the schools are now doing all that. So you got to do reading, writing, computers, and now you have to do the other things in terms of making sure that the kids are attentive based on having something to eat and having clean clothes. So that being said, the impact, and of course with homeless children, we just had a situation where they're in a homeless shelter. They had over 40 cases in a homeless shelter of COVID-19 and nursing homes. So when you look at the pandemic and what is having an impact and equity that is having on our community, it is a great concern. I'm more concerned after COVID-19, what are we going to do? Because the lasting mental health concern is where I'm focused on as well, because we're going to get through this and it's going to take some time. But let's be very clear, without a vaccine, what can we do?
Okay, thank you very much, Mr. Thompson. Sherry, would you like to share?
Absolutely, and I also want to commend not only our superintendent, Dr. Scribner, and his leadership team, but our teaching and learning division and our, I guess, maintenance and operations divisions, because we too have been working very closely with our community, because first you have to take care of those, as we learned from Maslow, those necessities. And many of our students needed those meals, and they depended on those meals from our school district. So we've learned some lessons. We were first going every day, and volunteers, including many from the Division of Equity and Excellence and across the district, came to make sure our students were fed. And then we also, Mr. Thompson mentioned about the trauma that many of, what I say, our students, myself, all of us are experiencing. I can't think of anyone in my circle of friends that hasn't been touched by someone, and maybe even a death, fatality due to COVID-19. So we're also connecting through our restorative practice team that has developed social and emotional resources that we as educators or we as parents can reach out to our families and say, how do we have this conversation? because we would never be able to go back and say school as usual. That is just, I think that's gone forever. We are going to have to say, what are we going to do differently? We had on in part of our racial equity chats that we've developed to stay connected and keep racial equity at the forefront. We had on our assistant superintendent of teaching and learning to just share. And we talked about, she shared with us an article and just said, what if? School needs to look differently. So we're challenging one another. We haven't gotten all of that together. We're still building it, but we are working on what can we do as a community to ensure the school doesn't we just come back and say, oh, get your books out again. That's just, I think we just can't do that. It has to be something differently done to ensure that we are taking care and hearing from our communities. And in Fort Worth ISD, we are largely a community. Over 80% of our students are students of color.
All right, thank you for those words. Dr. Howley.
Yes, first of all, thank you again for this opportunity. And like everybody else on this call, I am super proud of our district. And you all may have seen us in national news. We mobilized our school buses to make hotspots for our students. And as most of you know, Austin is the tech capital of the world. Right? We have everybody here. However, we've spent a great deal of energy distributing devices, the Chromebooks. And what my office has done, the Office of Equity, what we do, very small team, is we have connections with grassroots organizations. So even though we're hearing on the news and all of us are aware of, as Zach was saying, these disparate outcomes, these conditions already existed, as we all know. And what's happening is this pandemic is a magnifying glass. And it's showing, it's almost like when back when Katrina happened, we saw Black people on top of the Superdome and crying out. And this pandemic is doing this on a global level, right? And so our district has mobilized. And so people ask me all the time about equity. I said, our whole district is doing equity right now. Everybody, it's not an office, it's a mindset that we've looked at. How do we engage the most marginalized groups? And so my office has been in contact with our grassroots organizations. They're not the United Ways and the chambers and all of those mainstream organizations. These are folks that have boots on the ground. They have on their masks and their gloves every day. They're going into apartment complexes, seeing who has food, who doesn't. Because we know we haven't reached all of our students, and some of our students are transient, right? And some of our students can't be on our beautiful online learning. We're doing some beautiful things online, but some of our students are literally working at the grocery stores because the adults in the family have lost their jobs. And so there's the trauma of not even being able to be with your classmates, even if you do have a device. Economically, some of our students are stocking shelves to pay the rent. And so all of these things are having an adverse impact, as we all know, on our systemically oppressed students. And these health issues that are going on, I was talking to students the other day that have asthma, right? They've lived in apartment complexes with terrible air for all their lives. And so now, even at 16, 17 years old, they are threatened by this particular pandemic. So our school district is doing amazing work. Food services, we're now, we've gotten the funds to help provide food to caregivers. So on the weekends, I can't see, we just put out so much creativity and resourcefulness, but without our grassroots organizations, we wouldn't know who's missing. And so we're learning, every day we learn more and more about who we're missing. Our immigrant families, our Asian immigrant families are also getting the brunt of this. And we find that transportation is the single biggest obstacle we have right now. There are people that can't get to the food that the district is providing. They can't get on public transit and get to those spaces. So those are some of the things we're observing here in Austin. But I think we're knocking it out of the park in terms of trying to get to our marginalized communities.
All right, thank you very much. And Ms. Jacobs.
is on mute.
I'll just give a quick overview from a national perspective. We have been following what's happening across the country, and we've had conversations. For example, every Monday we talk to our executive directors in the states, and we've had some updates from Washington State, New York, Georgia, Colorado, Idaho, across the spectrum, if you will. And I would echo that a lot of great things are happening in our communities because people are stepping up to support students and their families. One of the things that has already been pointed out, and I won't belabor the point, but we know, is that now more than ever, I think we've come to terms with the fact that we need to get beyond traditional notions of how we educate students. And if we don't, in so many ways, we're talking about distance learning, and that it's, I think we've shied away from that as a public education in this country. And the reality is children learn in different ways. And so what we're seeing across the country is that the disparities that exist pre-pandemic are just exacerbated by the pandemic. And so the question really becomes, so what next? And how do we catch up? And is catching up really the question that we should ask? But there's much more to the conversation too around lack of access to health care. So when we talk about access and opportunity, this is impacting families across the country. And I would say, the Washington Post shined a light on my very community this past weekend, and looking at a community that supposedly of wealthy Black people who have the highest rate of death in this region. And so I say that to say that we have to dig deeper when we're talking about inequities and what that looks like, because we don't just come to the table where we start in our great jobs or whatever. We still have the history and how we get to where we are, and our children are suffering from the same the same issues that play out in our community. So we have to broaden this conversation around what equity really means.
All right, thank you very much for those comments. And I definitely look at impacts. I mean, we won't know those at this point. It's going to take some time for us to really realize what the impact has been on our students and also on our educators. But we definitely need to look at some kind of funding mechanism to begin to prepare for that. And I know your superintendents and mine is also working right now to look at plans to ensure that we have funding. From a national level, we have to talk to our legislators to ensure that they know what's going to be a burning question coming forward. Our next question is, what do you believe are the great disparities that we will see as a result of this pandemic? Who wants to take this one first? All right, Doctor, you're smiling. Dr. Hallie.
I just know, I think as we all know, that we're going to see that the students who had access to the devices, who had internet connection, and who had parents who had the privilege of staying home helping them navigate online, will continue their learning. And there's nothing wrong with that, except that we have our students who whose parents are deemed essential. We have our students who do not have access to Wi-Fi, who don't, and we haven't yet gotten devices to. And we know that we're going to see a difference in what occurred. And I think what we're going to have to do as we move forward is not look at the students who didn't have access or privilege of parents who speak English and parents who were able to be home, but we're going to have to take every student where they are, and we're going to have to look at some what we call personalized and blended learning when we get face to face with our students again. And we're going to have to make sure that tech devices and online learning is a natural part of the way we do education. And folks have asked, what's going to happen on the other side? And we can't really decide what the new model is unless we bring the most marginalized people to the table. And right now, when we are able to speak with those folks, we are hearing those despair and the trauma. Somebody mentioned earlier, I think it was Sherry, the trauma that everybody's going through at some level. Some of our students live in trauma every day before this. And so this thing is a double down on them. And I think it's going to be crucial for us not to work with our students, particularly Black, brown, and low-income students, as if something's wrong with them. Because we use words like interventions. I heard that even before the pandemic. I'm like, the babies aren't sick, the system's sick, not the babies.
Exactly.
And so for me, we're not going to know exactly what happened on the other side until we actually engage the people who were most adversely affected. And I think it's going to be critical to go in there looking at building on their resilience and understanding and knowing that they've learned some things. It may not be the things that were online that they learned, but there are some survival things that they learned. And there's some, we hear that term grit all the time. I get exhausted from the term. We got to teach the kids grit. I'm like, our children have grit. They sometimes have to catch 2 buses to get to school. They figure out how to eat. And so I think if we, on the other side of this, learn from them and hear directly what their stories are, and then build on their strengths to move forward and not do comparisons, because that's what we typically do in education. That's how we get that term education gap, right? We're comparing them to white kids, white middle class kids. So if you don't have the outcomes of a white middle class kid, then there's a gap. And I get all that. But what it does is it doesn't help us to look at the generational strength that Black, brown, immigrant children bring into the space. So I don't know if I answered your question, but I do want to say that we're going to learn firsthand from our students what the problems are. We know we can get some of them, but they're going to tell us some stuff that we never even dreamed.
Okay, thank you very much for that. I think it definitely opens up a lot more dialogue for us. We have more questions than we have answers.
Let me throw a perspective in, Ty, on the global piece. The statewide perspective is on funding in the legislature. Where is the commitment? Because we're moving into an economic time that we've never seen before. And so we hope that school districts will not be impacted as it relates to funding. So now's the time to educate our legislators, because it's going to be key. We know the challenges. They have a rainy day fund nobody wants to touch, but it's past raining now. And so the issue is we don't want equity to take a back seat because of the shortfall that could happen. I guess my question is any of the COVID funding that we're seeing on a federal level, will school districts be able to recoup the monies that they've utilized in doing support services during this COVID response activity? And so those are the kind of issues that we have to bring to the table. Now, to the community, the concern is always going to be the assessment. The school district has done a great job, but again, how many of our students don't have laptops? How many of our students don't have access to internet? There are still pockets, and again, thanks school districts for providing that. But again, there's still pockets, even in Dallas, that there is a gap in terms of communication via the internet. So those are the kind of challenges. And again, I'm going to go back to number one. They say it's not about money. Yes, it is. And at the end of the day, our teachers, our administrators, they got to be properly funded. And then when we start talking about doing services for our kids, we got to make sure that we're not left out as they begin to divvy up the money. This discussion today from the governor on whether they're going to open or not, let's be realistic. This is about sales tax. This is about money coming to the state. The longer we're closed, the less money is coming into the state.
Bottom line. Ms. Jacobs, if you would give us from a national perspective.
Well, let me just first say that, one thing is really clear, listening to Mr. Thompson just now, it is definitely about resources, but I want to be clear, it's about the intentional allocation of those resources. And that is one thing that we are constantly pushing when we're talking about equity. If before the pandemic, we weren't paying attention to how we're allocating resources, we most definitely need to be doing that now. And so from the perspective of what's happening in the States and how resources are being allocated, that we go right back to get to this COVID, your question about the COVID-19. I mean, we got 13.7 million in the first round. And I'm sorry, we got 13.7 in the first round, and who knows what that's going to mean. But not $1 of that went to E-rate funds. None of that went to access to broadband and things like that, which is what we most need right now when you're talking about children having access. So I think, things like trauma-informed practices and social emotional learning have to be not these extra programs in schools. They have to be part of the fabric of how we do business. And I think overall, if you think about the way nationally that we're looking at the political structure, quite frankly, we have to be cognizant of the fact that our communities have to be prepared to, yes, advocate at the state level and federal level for funds that are necessary. But I always bring it back. Politics are local, and locally we have to make sure those funds are allocated in the way that they need to be across the country for students. Otherwise, we can sing the same songs over and over again when it comes to the lack of resources that students are having. We have to make sure locally we're also doing what we need to intentionally allocate those resources.
All right, thank you very much. Ms. Breed.
As I was listening to my colleagues just respond to the question, I was just thinking one thing the pandemic has done is once again highlighted the inequities that we see all the time in our districts and really in city and all across the nation, actually. So I think I hope the pandemic was we learn from the lessons. We'll see a change in mindsets about having conversations about inequities. And these inequities are caused, as I think Dr. Hawley said, it's not about our students not having the abilities or the resilience, but it's about not having access to some things. And how are we going to change that when we come back to the school? And I think we do want to engage. One of the lessons and conversations we were having within our equity team meetings and conversations about what can we do to prepare for when we go back is asking the community, what is it again that you need after this coming back from the pandemic? We think we know, but sometimes we come from that place of whiteness in our mindset. Sometimes we need to step out and say, let me listen to the community of what they need. So we do have in Fort Worth ISD positions that our board has been so gracious to continue to fund that work directly with community. It was formerly Historic Stop 6 Initiative and Eastside Alliance. We've now put them together under the Family Action Center East, reaching out to our community, trying to educate them about the importance of taking the pandemic seriously. And yes, you should be social distancing, and why? And then still listening and helping them access other needs, because as we've said, families are considered essential employees. They're still working, but others have been furloughed. And we don't know when they're going to be returning. So we've had them to say, what are some accesses to I think through SNAP and through how do I get my utility bills paid? How do I access whatever the needs of the family may be? So we do have and those communities and that structure that reaches out to the grassroots community. We had just recently hearing from some of our ministers that had a line to work with meal distribution, and not just meal, but other services. But then we hear from them to say, while we were having the conversations, my congregation wants to know, I hear, because some of them are senior citizens that are working with the young children. Maybe they're the daycare while the parents are at work right now. And they're saying, well, I don't understand about the online system. And maybe these students have been connected. They're the ones that are saying, we can put you in contact with either the district staff or the principal of the campus, or we can make connections for you, whatever that's needed. So those are the kinds of things that we're doing to stay connected with our community and listen to them tell us what they need from the district to help them prepare to go back. And even as we're in the midst of this pandemic, what can we do to offer them the support?
All right, very good. Thank you all for those responses. I think what I've really captured is that those disparities will hopefully close those gaps in the areas of access, allocation, and just people being more knowledgeable now, because the districts and the other organizations are now providing them with more information on how to receive certain services. So,
Hey, Ty, can I just say real quick, just in response to, I think we have to acknowledge that the lack of trust is real in communities across the country. And we have to acknowledge that as a real thing. And it's real for a number of reasons that we don't have time for on this call to get into. But I think that also means that we have a greater responsibility in our own communities to educate and to bring people along. It's our job. You know, when you have more knowledge, you much is more required of you. So I think that's a part that we haven't touched on in terms of this in terms of this conversation. Yes. Okay. Hi, my son, everybody. In terms of this conversation is that the lack of trust in our communities is real, and we have to have conversations about that as well to help with healthcare and access. You know, we still have people who don't go to the hospital for different reasons, and again, I just think that lack of trust in our communities has to be addressed.
I totally agree with you, and I think it's very important that I've heard from the other districts and what they're doing to engage their communities and make them more knowledgeable about what is being offered and how they can actually facilitate some of those connections. Our last question, which is a little lengthy, hopefully you guys have it before you. I'm going to read it if everybody else has it as well. If we were to imagine a quadrant of suggestions for district policies for school board members and suggestions for district practices for superintendents and administration during both during and after this pandemic, what suggestions might you offer for district policies and practices both during and after this pandemic to address disparity and issues of inequity? So a lot of you have done the stuff before because a lot of you are within the areas of equity. So what do we now put in place to address some of those same concerns and issues after we get past this?
You know, Ty, I've been at AISD since August 1st. I'm a 39 years in education, and I did equity work at Austin Community College, and I've been here about 9 months. And one of the things that at first it was just me. I do have 2 other staff members now, but we found that you can't change mindsets, as Ms. Breed was saying, without giving people tools. So many of us, particularly if you're African American or person of color, you're thinking this event is certainly going to change minds. And even 2 or 3 weeks into this, our staff was seeing no, people were actually doubling down on some of their and I'm going to use Ms. Breed's what she said a few minutes ago, doubling down on the whiteness. So went more into urgency and distribution of things and just into a frenzy, right? Which is understandable from a human standpoint. But the thing that I think all of our districts need and our leadership needs, leadership development for equity has got to be an ongoing part of the culture. And it has to be pervasive, but people need tools. And so our office has been developing decision-making tools. And I will send those to you all when we finish this conversation. But the questions you ask yourself to see if you really engage in equity or charity, right? Because you can get engaged in emergency charity. And then when this thing is over, we go back to the same mindset. Even though we feel really bad, we haven't changed policies. And I always tell people, if I don't see equity in your policies, and I don't see it in your budget, and I don't see it in your strategic plan, then you're just doing real nice things, feeling real bad. And so I would say policies that all districts need to put into place has to be with leadership development for racial equity and look anti-racism in the face. We can't keep using words like, well, we can, implicit bias. Those are those soft words, right? That let people kind of skate around like we all have implicit bias. It's like, but our system is showing us that we have deeply racist outcomes. And so that means we got to look back at our policies. And so policies to make sure leadership is under constant development, continuous development. And that means board members and senior leadership. And we need to make sure that when we come back, all of our teachers are engaged in cultural competence, cultural proficiency, or what I call culturally sustaining pedagogy, so that we come back, we don't do damage. Other policies we need to have in place is, do all of our Title I schools have what they need? And are all of do we have experienced teachers at all Title I schools? And are we still sending the newbies? Are we still sending the inexperienced ones? And so those kinds of policies to make sure children have the most experienced and culturally proficient teachers and leadership, that's going to be system changer. Anything else is going to be nice things that we do. And somebody said earlier about this whole piece about changing the mindset. You got to change the system and the mindset while we also help to rebuild the trust with the community that doesn't necessarily trust big systems that haven't served them well. So I think unless you get those leaders trained, those teachers developed, we will slip right back into old habits, and we'll feel like we're doing equity and we'll call it equity. But it really is charity and feeling bad, and that's not useful for the children. We need people to set high standards and build on their strengths, but we've got to build that into the policies.
Okay, thank you very much. So for the next responses, we're running short on time. We'll give you guys 65 seconds to respond as well. So let's go with Zach.
Well, I think the only point I'll make it real short is, my concern is always going to be the funding, equity, but above all is what are we going to do in terms of pandemic planning? How school districts involved with their public health departments in terms of pandemic planning? I have to apologize what happened nationally. We went from it's going to be flu to now it's a pandemic. So there's a lot of confusion on a national level. And so we really got to do pandemic planning and making sure you're working with your local health departments on pandemic planning.
All right, thanks a lot for that, Mr. Thompson. Ms. Jacobs.
Sure. I'm going to jump right in real quick with some data that we all know. We still know that 80% of the teaching force in this country is 80% white female. And guess what? 78% of school board members are white males, typically. 59 years old, average age, make over $100,000 a year. We have a lot of work to do. That is not to say that people that are not of color don't get this work, but all of us, to Dr. Hawley's point, all of us have to be having these conversations and realize who's sitting in the seats making the decisions. And that means that we have to do an in-depth analysis and review, if you will, of what that means. And educating on, we may not like the terms implicit bias, but I would just add that we have to start somewhere with groups to make sure that the decisions that are being made are in the best interest of children. And in order to do that, we have to have policies around cultural competence. We have to have policies around social emotional learning, trauma-informed practices. And not only that, as I think about the models of teaching that we have, as I said before, we have got to get past the traditional ways, that one best system, and what does it look like? What does the child need, not what the system and adults need, and stop blaming children for how they show up in the classroom.
All right, thank you very much for that, Ms. Jacobs. And Ms. Breed, we'll close out with you.
Okay, I was just thinking, in Fort Worth ISD, we were either not the first, one of the first to develop the racial equity policy. And of course, people wanted to know why were we talking about race? And some of the things that we just listed here in the conversations about how we're going to teach our students, expectations of the number of students that are referred for special education services, just a number of things. My thought was what we need to learn from the pandemic is that as we go back, we know that we're going to have to, school should look differently. I say should, so we were going to start there. Then we will go back to our policy and be, as we say, we're going to be bold and unapologetic, and we're going to talk about race, and we're going to talk about the inequities and lessons learned from the pandemic, because we've been talking about it in Fort Worth ISD for 4 years about race and equity. But still, mindsets, in my opinion, have not changed as quickly as certainly I'd like for them to. They were still here. Well, poor little Sherry. Well, Sherry's perfectly fine if we give Sherry the resources and the scaffolding of learning and insist that she's going to be successful. So I think that's where we would start in Fort Worth ISD, going back to our policy and being unapologetic and having frank conversations and put it on the table. And let me just add this, our board of trustees have been pretty bold in stepping out there and saying some things and put the resources into our equity division.
All right, thank you very much. Definitely like to affirm your board, Centaur Ramos, president of CUBE, now chair, and also Leadership ISD. So definitely want to affirm him and the work that the entire board of Fort Worth has done, also Austin ISD's board and my board here in Lancaster ISD. I'd like to open it now to questions. I believe Jamie is going to come in and assist us with that.
Happy to do so. We have 17 minutes remaining, so we're going to do a lightning round of questions. We'll ask our panelists to be concise. We'll invite our attendees to raise their hand or to type their questions. The first question is from Stan Paz, who says, connectivity is critical for our communities and is now more important than ever. Briefly, what do you recommend for school districts to help bridge the connectivity gap?
Or who wants to take that one?
I'll start just quickly. If we have, because we have some of the similar, I believe, concerns or challenges in our districts. So we have opportunities such as this to talk about what are you doing? And then there may be opportunities for us to partner, because I think it's going to be important that we stand together. And so that's just what immediately came to mind, because it's no need of us reinventing the wheel if we can learn from one another and implement.
Yeah. I would say the very same thing. But I would say that it's really important for our schools to have genuine relationships, our teachers have genuine relationships with our students. So connectivity is not just tech, but tech is really important. But I think when we come back in, I think we will see our devices as fundamental, as a fundamental educational right to have a device and internet connectivity. And I think working with our municipalities and with our city and our county to make that happen, and just a collaborative effort to make it, just make it so as a collaborative.
Well, and there's still areas in Oak Cliff that you still can't get broadband access. So I think the key is there's a structure here. And so why in 2020 do we still have spots where you can't access the internet?
Okay.
Next. We have a question.
Yeah, go ahead, Jamie.
We have a question that comes from Deborah Peoples. What do participants see as the model for education for our students going forward? Briefly.
Right, Ms. Jacobs, you want anything to share?
Well, again, one size doesn't fit all. And so I think the model for our students going forward is what does each child need to be successful, and give it to them. And so I know the backlash to that is always, well, we don't have the resources for that. We must do it. We must figure out ways to meet children where they are. Otherwise, this country is not going to be what we need it to be. And so that's my simple answer. One size doesn't fit all. We have to you have to talk to the community. You have to know what the students need and adjust your budgets, accordingly. School boards, stop voting on budgets that do not align with what students need.
Correct.
I would say personalized and blended learning. We have good models in our district of that happening already. So we need to build on some of the success we have here in AISD.
I would just close out by saying, also looking at the virtual learning that we've been all forced into, learning more about that, so that some courses that were on one side of town, not on the other side of town, they can have access, because we see that we can do this when we absolutely must. And the funding, I think, is there.
And virtual learning, as we go forward, we're going to have another pandemic, so we might as well get prepared now.
All right. Thank you all very much. Any other questions, Jamie?
Kay Douglas asks about the intentional allocation of resources. She notes that we're in the middle of our 2020 US Census. Any thoughts that you have on the necessary allocation of resources to have a more accurate census?
Good question, Kay.
What's the answer? Yes.
Use some of the stimulus money to make sure we do that, right?
That's absolutely right. We've been pushing the census here in Austin because we know it has just a phenomenal impact on how we will be funded in the future. And we know that our Black and Brown communities are undercounted by, we don't even know how much. I mean, there have been studies done by the undercount. But we, through this entire crisis, all of our communication, we talk to parents about making sure they complete their census forms.
I would just say through the district, those resources from the community. I think they have had some conversations of the importance of completing it, and even, I think, offered to assist, but that is that is something certainly we could probably circle back, because we know that, just like it's been said, our Black and brown communities may not have been reached yet, are looking for it and understand the importance of of completing that very short survey means to our communities.
Here's a deep question from Chloe Sykes of IDRA. What do you all recommend for advocates to help school board and district leaders to transition from superficial understandings of equity toward transformative approaches to systemically embedding racial equity in their work?
That was deep. Who was that? Idra? that was deep. I go back to relationship building. In order to support, it's hard for leaders to humble themselves to realize that we are engaged in systemic inequities, and we don't get up in the morning. So helping people understand there's a difference between systemic racism and personal racism. And when you start talking about structures and systems and history, that's what we're talking about, that's creating this. And so for a lot of leaders, they're gun shy about this because they feel like someone's personally attacking them. Ouch. And then there are Black and brown people as well who have power, who don't want to be perceived as participants or and people who benefit from these systems. But it's crucial work that has to be done. And, as an equity officer, we try to do it with love. We try to do it with persistence. We try to do it in a way that's not shaming to people. And we try to help them understand that we're producing inequitable outcomes by race. And so therefore, there's something in the system that needs to be studied. Leadership is something in the system. Resource allocation is something in the system. Teaching, all those are pieces. How we engage the community, that's something in the system. And so helping people come to this understanding that we're talking about systems, and we're not talking about you personally. And charity, again, is not, and doing nice things is not equity. And so it's unfortunately takes some time, but we're talking about a 500-year-old problem. But it's through building those relationships and those connections and helping people to understand that together we can dismantle this and transform. So this COVID crisis gives us an opportunity to just take everything down and really start to rebuild from an equity instead of adding equity onto the backside of the house. Not succinct, Jamie, I'm sorry.
No problem. Other ideas, transitioning from superficial understandings toward embedding racial equity in our work.
I was just going to share, in Fort Worth ISD, we've been engaged in systemic racial equity transformation for 4 years. And the board established the Racial Equity Committee, which is a diverse group of individuals from parents, community members. We have a few staff members on it, faith-based, college education professors. So we all come together. And so we're trying to do the work differently, keep going back to our policy. So we divided up into subcommittees so we could hear from our communities and hear from others about what we should be working on. We're looking at a number of things I won't take time to go into now, but I think that would be one to keep us listening to the community, connected, and not always trying to be the ones coming up with all the solutions when we haven't really asked the people that we're trying to serve. What is it that you think we should be doing?
And the only thing I would add is that when you look at what's transpired in terms of what we see on TV, and even from the school district standpoint, the only time I've seen people reach out to African American community regarding COVID-19 is for ministers to talk about the congregation and praying. So this transforms all over. We don't take African Americans and Hispanics seriously because there's enough talent in our communities to get our Black doctors, our Black nurses involved in this response, as well as involved in our schools. So as we see people on TV, none of them look like us, and they're telling us that we got to do certain things. So that's no different than what we see in the school districts or in corporate America.
Right. I'll say I would just add to that question, Jamie, is just reach out to your local officials. They want to hear from you. They want to identify what your challenges are. Me as a board member, I want to hear from my constituents to identify what their challenges are and what their potential solutions could be. And I can take those to the table when I meet with our board and with our superintendent. So keep in mind, our doors are open to hear from you and get your perspective. And therefore, we can then utilize that information to better equip us and to be better equip our communities accordingly.
A few last questions. AS asks, what metrics would you recommend districts use to guide equitable academics, socio-emotional health, and implementation during this pandemic?
I don't have a response about during the pandemic. I can share that we in Fort Worth ISD have been working on a tool that we can use to assess how we are working on our equitable practices. Are we changing our mindsets, and how you measure that? That's where we're working with our data analysts and data teams at the central level. So we are trying to have some metrics developed so we can determine if we're making the progress we want and going back to our racial equity policy.
And I just want to say thanks so much, Ms. Breed, because I've got to connect with you after this. I'm so delighted to be on. At AISD, we have an equity framework, and we find that people rush into wanting to get things measured quickly, and they're not paying attention to the whole human being because we want to measure and show progress so quickly. And so we have a 10-point equity framework that we put together with our community over the last 8 months. And then that's going to lead to us developing metrics that make sense. In the past, we've had metrics, lower targets and standards for Black and Brown students. And we know that's not equity. Everybody, the standard must be the same, but people need to work through an equity framework in order to develop those metrics. So you just can't sling some numbers out there. It has to be developed and collaboratively with our communities as well. So it takes a little time and it takes some tools to do that.
Ms. Jacobs?
Oh, yeah, I would just say real quickly, when we are doing our professional development across the country with school boards, there are 4 key areas that we talk to them about, and it's intentional allocation of resources. I've said it 1,000 times in this call, but we talk about what that looks like. We talk about what curriculum looks like in terms of how we how students get access. We talk about effective teaching. When I was a school board member and served for 10 years, we were given, $30 million a year in teachers to get their master's degree with no correlation to outcomes for students. So have a conversation about that. And we talk about safe and supportive schools and what that means. And so there are data points associated with all of that. If you're in a school district and the Black and Brown children are the only ones suspended and expelled because of disrespect and things like that, you should be asking some very specific questions. So I think there are definitely things that we can look at and that school boards and districts should be looking at to show where the disparities exist, who's doing it, and as we started this conversation, identify it and eradicate it.
All right, thank you.
Last question, our last question of this conversation, briefly, what significant budget line items are you advocating for in response to COVID-19? What significant budget line items are you advocating for in response to the COVID-19?
I would say making sure we get high quality teachers and get our most experienced teachers with cultural proficiency and the social emotional background. We've got to invest dollars in that, and we've got to invest dollars in making sure we attract Black and Brown teachers so our students can see themselves in front of the classroom, because the single most important thing that's going to happen on the other side of this is the teacher.
Yeah, and somebody once said, if they don't treat you right, how can they teach you right? I think we have to have counseling services, be supportive to make sure we're doing some outreach in the community. But above all, I can't say this enough. We have to have African-American, Hispanic leadership involved, committed to working with our communities.
I was just going to share much along those lines. As we go back, in addition to all those things about having teachers that have a change in mindset, that have a heart for building those relationships with students and getting down to bring teaching culturally relevant practices into their lessons, including those. We also can't forget, as we return from the pandemic, the social emotional needs of our students. So we may have to spend some time talking about it, having some kind of connections, because I'm just thinking we as the adults have been through a lot of trauma ourselves. We may have to spend some time there. Then we do a lot of trauma ourselves. We have to spend time there.
All right. Mr. Jacobs, do you have any words?
Right. Mr. Jacobs, do you have any words?
No, go to the next question. I don't want to hold it up.
I believe that was our last question.
Oh,
That was our last question. We'll have any concluding words from our moderator, and we'll welcome back President Ramos.
All right. Again, I want to thank each of you for joining us today. Again, Zach Thompson, Sherry Breed, Dr. Howley, Gina Jacobs. Really appreciate your insight and sharing those topics. I look forward to getting that document that you referenced, Dr. Howley. We can kind of begin to look at that and share that with our respective districts to see how we can better equip our communities and our districts with the necessary tools. One of the things I like to share when I'm doing any trainings are the 3 R's. That is to read, relate, and to reflect. So in anything that we do, make sure that you guys are reading and becoming cognizant of what your capacity building or your capacity deficiency is, begun to become knowledgeable within that area. That's going to be the read. Relate is to begin to form relationships with individuals like these who we have on the call today, and also your fellow board members in neighboring districts who are doing great things. And lastly is to reflect. Reflect on what's working and what's not working to improve in those outcomes. Again, thank you, and I'll turn it back over to Senator Ramos, and also thank MASBA and Leadership ISD and the caucus.
Thank you to President Jones, our moderator, also to all of our panelists. For those who are listening in, please join us next week. Monday, May the 4th at noon, we'll have a pandemic policy perspective, what educational leaders should know, with Dr. Carrie Sampson of Arizona State University and Dr. Julian Vasquez Heilig of the University of Kentucky College of Education, moderated by Trustee Holly Maria Flynn Villaseca of the Houston ISD. Appreciate you all tuning in. We'll see you next Monday.
Thank you.
Thanks, everyone.
Bye.